Insights Mind Maps. www.insightsindia.com. Page 1 www.insightsin.com. General Studies 2. Topic: Issues relating to development and management of social sector/services relating to health. Fight against leprosy. 1. Introduction. Leprosy is one of the world's oldest diseases, with India accounting for over 60% of the annual new cases of leprosy. To present status, leprosy was officially declared eliminated as a public health concern in India in 2005 when new cases fell to less than 1 per 10,000. Yet India still accounts for the largest number of leprosy-affected people in the world. Official data says that the number of new leprosy cases detected during 2016 to 17 is 135,485 and the prevalence rate per 10,000 population as on March 2017 for India is 0.66. The current global prevalence is estimated by the World Health Organization to be 0.23 per 10,000 population. In 2017, India along with Brazil and Indonesia are the only countries where more than 10,000 new cases are reported per year. 2 out of 3 new global leprosy cases are detected in India, according to official data. 3. Present crisis: lack of awareness, myths, socio-cultural beliefs, and the stigma attached to leprosy are the most pressing problems before public health activists today. Persons affected by leprosy continue to face discrimination not only from the larger society but also the disability sector itself. Leprosy causes a negative impact on children's life, study and work. There are currently 119 provisions across various acts passed by the central and state governments that discriminate against people affected by leprosy. These 119 provisions not only violate the rights of persons with disabilities Act 2016, but also Articles 14, 19 and 21 of the Constitution of India. Almost all of the marriage and divorce laws of India consider leprosy as grounds for divorce. Many states in India prohibit leprosy patients from running in local elections and deny them employment privileges and benefits. In 2010, there was no district in India with a prevalence level of more than 5 over 10,000 population. In 2017, there are 4 such districts. For concerns/challenges, major concerns include undetected new cases, problems with leprosy integration, the presence of leprosy in children, and paucity of education and training for livelihoods. It is highly unlikely that India achieves elimination of leprosy at the state or district levels anytime soon. Leprosy is becoming more of a disease of most marginalized and underserved populations in far-flung areas. In the Adivasi community, the percentage of leprosy patients have increased from 13.3% in 2009 to an alarming 18.8%. Insights Mind Maps. www.insightsindia.com. Page 2 www.insightsin.com. The earlier gains in containing the disease have stagnated and we are at risk of re-emergence of leprosy as a public health problem in substantial areas of the country. Rampant stigma against the disease prevents patients from seeking medical treatment. A large number of leprosy affected fall in the category of persons with disabilities as they hesitate to come forward for treatment. 5. Supreme Court ruling. The Supreme Court tasked the Center, states and union territories to undertake a campaign to spread awareness about the curability of leprosy so that those suffering from it are not discriminated. It recommended for repealing archaic provisions from 119 statutes that stigmatize leprosy patients. No government hospital shall decline treatment to leprosy patients. People suffering from leprosy also have the right to live with human dignity. Programs should be telecast on All India Radio and Doordarshan. The campaign should be done even at Gram Panchayat level to help end discrimination and ostracization of those suffering from leprosy. 6. Government interventions. India is currently running one of the largest leprosy eradication programs in the world, the National Leprosy Eradication Program (NLBP). The National Health Policy 2017 (NHP) has elimination of leprosy as a national level target. Leprosy Case Detection Campaign (LCDC) is being implemented by the Union Health Ministry. SPARSH Leprosy Awareness Campaign (SLAC) was launched on 30th January 2017 to promote awareness and address the issues of stigma and discrimination. 7. Way forward. The emphasis must shift to more policy level changes and sustaining quality of services. The government must implement the key recommendations of the Law Commission on Rights and Special Privileges. To reduce the burden, it is important to develop a multi-pronged approach that includes public education campaign, sustainable livelihood programs, skill training workshops, and generate employment, identify interventions to dispel stigma and mainstream the affected people. Continued training of medical officers, nurses, physiotherapists, and paramedical workers without quality diagnosis and treatment of leprosy must also be given prime focus. Public education on the fact that leprosy can be cured and is not to be feared is imperative. Those who have been cured at an early stage and can work often need to be given opportunities to learn skills and trades that would enable them to work. 8. Conclusion. Policymakers, health professionals, civil society and public health activists, each of them needs to act as a change agent through their representational, legislative and activists' roles to win the war against leprosy. 9 facts for prelims. Leprosy, also known as Hansen's disease, is caused by the bacterium Mycobacterium leprae or Mycobacterium lepromatosis. Insights Mind Maps. www.insightsindia.com, page 3. www.insightsos.com. The disease affects nerve endings and destroys the body's ability to feel pain and injury. It is chronic granulomatous disease that mainly affects skin and peripheral nervous system. It can also affect the eyes and respiratory system. It is curable with multi-drug therapy (MDT). It is classified as a neglected tropical disease,